So my name is Adeeba Kamarulzaman. I trained as a physician, specifically as an infectious disease physician in Australia, and lived there for many years and returned to Malaysia in 1996. When I started to work for University Malaya and set up the infectious diseases unit, and treated patients, not just with HIV, but with dengue and other infectious diseases. And then got very much involved with the Malaysian AIDS Council, an NGO, and that's when I broadened my professional career into HIV prevention and advocacy. And for many years worked in as a mixture as an academic scientist, clinician, as well as leading the Malaysian AIDS Council and the AIDS Foundation. Then in 2011, I was asked to be the Dean of Medicine at which I stayed on for 10 years. And there, I guess I endeavored to strengthen medical education, both undergraduate medicine, nursing, to a point pharmacy, as well as specialist training program, and also expand medical research in the country. I then what is called Bersara Wajib in 2023, and I'm now at Monash University, Malaysia, as the Pro Vice Chancellor and President. In a sense, going back to where I came from, because I trained as in medicine at Monash University, Australia, but also did a large part of my training at Monash related hospitals like the Alfred and Monash Medical Centre. So I grew up in Kota Baru and was at Sekolah Rendah Zainab 1 until I went to TK's Tengku Kusha College for my secondary schooling. I grew up in a very large extended family in Kelantan with my aunts and grandma and cousins, in this huge family. And I guess I can say Kota Baru in those days was very, very different from what it is now. It was and I think in many ways, of course, families shape you, and my family was very progressive, and the question of race never wasn't part of the discussion at all. Even in those days, Kelantan was more Malay, but I have friends from all races, and in fact, I must say there are 6 of us now who are friends since kindergarten. I've just got invited to one of them's wedding. She's getting remarried in January, and we've remained very, very good friends since kindergarten. I must say, not many people can probably claim that, and we stay in touch very much so. So, yeah, I had a very happy childhood. Played lots of sports. And this friends that I described, who we still are friends now, we actually bonded over swimming lessons. Now, it's hard to believe that this was happening in Kota Baru in those days, but this friend of mine comes from a very prominent family in Kota Baru as well, and I think her family had the first swimming pool in town, and we all learned to swim in her family pool. And of course, had a great time every weekend learning to swim in her family pool. And then went on when the State Department built a swimming pool at the schools complex in Kelantan. We then went to formally train there, and lo and behold, we were the first swimming team to represent Kelantan at the national school swimming meet I think at the time it was at the Welt pool, and actually won third. We were so proud, still are proud. We talk about this all the time, that this, like this dark horse from Kota Baru won the 4x50 relay in women's swimming. So yeah, I think those kinds of things kind of shaped us. And I must say that the swimming training, I mean, we were, when I look back at it, we were little kids, we were, well, 10, 11, and we're getting up at 6 in the morning to train and did our life-saving medals. And but looking back, that these are things that probably shaped me in terms of discipline, in terms of, striving to be the best and all of that. Disappointingly, the Kukusha College, which ostensibly is one of the best medical schools, best schools in the country, didn't have a swimming pool, because I wanted to continue my swimming, sort of doing competitive swimming, because it was the only sport I was good at, I think. I certainly wasn't good at basketball because of my height, and no netball and all those things that were de rigueur in those days. Yeah. No, they didn't. I would have volunteered to be part of that team. What a shame. Yeah. So that cut my swimming, prowess short. Yeah. Absolutely not. I do not come from a medical family, but strangely enough, two of my brothers are doctors, and who married doctors. And one of my sisters also married a doctor. So we have a large number of doctors in the family. Only in that generation, a cousin also became a doctor and married a doctor. But other than that, of our children, that third generation, if you like, third generation, only one nephew has chosen medicine. Others shied away from it, including my own two boys. Yeah. So one's a lawyer, and the other one is an environmental data analyst. My father was a person in civil service, and my mum, like many her age, I mean, she's passed on, but did so well into her 90s, was a homemaker, a brilliant cook. She was multi-talented, a brilliant cook. She sews really well, and I think I got some of that spirit from her, because she was hugely independent, even at that age. And even though we come from a relatively privileged family, was earning her own money, making clothes, and all of that. Yeah. And she always says that, if she had the chance, she would have made a brilliant doctor as well. It's just in those days, I guess girls didn't go to school, or not didn't go to school, didn't go to tertiary education. She certainly went to school, but that went to the boys instead. So when I was at TKC, I did relatively well, and was the chosen few to go to Australia before on our forecasted SPM results from JPA scholarship. And even then, I still didn't know what I wanted to do. So when did my sixth form in Australia, and then got good results, and like, okay, now what kind of thing. And it was as much a process of exclusion. I didn't have the aptitude for engineering, so it was and those. I mean, I was in a STEM stream, if you like, and thought, yeah, why not medicine, since I made the grades, kind of thing. Yeah, it was easier. So when you graduate, and I stayed on to do my housemanship, you have to decide whether you want to go into surgery, medicine, surgery, pediatrics, and obstetrics and gynae. I very quickly dismissed obstetrics and gynae, even as I was deciding, I couldn't see myself getting up in the middle of the night to deliver someone else's baby every single night of my life. So that was an easy no. Pediatrics, I think, where I trained, didn't have a very strong pediatric component. So, with medicine, because it's a lot of it's apprenticeship and what you've experienced. So I didn't have not a bad experience, not enough to inspire me to do pediatrics. And so it was left to medicine or surgery, and I was much more inclined to medicine. And as you train, you go through different disciplines. Initially, I wanted to do cardiology, actually, and come back and, help Tan Sri Rubaya at IGN, that kind of thing. But it was too one-dimensional as I trained and got more senior. I think it's the broad discipline of infectious diseases that you have to know the body from head to toe and beyond just one organ, and also beyond just medicine. And it was in the early days of HIV/AIDS, and got to meet some really inspiring consultants and really inspiring patients, and that was it. And I worked in this really beautiful hospital called Fairfield Infectious Disease Hospital as a infectious disease registrar. It had peacocks in the garden. Staff were wonderful, and yeah, it was a really lovely experience. Yeah. My mother and aunt, I guess, were the two biggest influences in their own way. My aunt was this beautiful woman, both physically and in spirit. And like I said, I think that's where I got my kind of ability to speak to all levels of society, because again, my mum and everyone came from quite a privileged family, but was able to connect with everyone. I remember, you were talking about the entrepreneurial Kelantanese, and when I was a kid, I grew up with my aunt in my early years and grandma, rather than my own family, and that's a separate story. But well, it's not really a story. My father was in the civil service, and he was transferred to Jesselton. It wasn't even Kota Kinabalu in 1964, and I was like only 6 months old, and my brother and sister and sisters were all under 5, and my grandma said, you can't take like 4 kids under 5, under 6, whatever it is, to Jesselton, which was in the old days like really the wild west, and so left me behind. And when they came back, I was like, I'm happy here, and so stayed on with my second family, so to speak. And so I'm very lucky to have 2 families. And so back to my aunt, I used to go with her to the Kota Baru market, which is still what it is today, and she would connect to the fishmongers, the ladies who sell vegetables and all that, really, really well. Yeah. So I grew up with my aunt in Kota Baru, and I was essentially her youngest out of 7. She has had 7 children of her own, and I would tag along with her to the Kota Baru market, and loved the way she connected with everyone in the market, from the people who sold fish to, people selling the fruits. And I think it just came naturally to her, and perhaps, all that helped me kind of connect in my work, in the sense, particularly around the work I do with people who use drugs, that I do feel that I can connect quite easily with people in prisons, or people at, people who use drugs, right all the way to Nobel Prize winners and former presidents that I now find myself in the company of, with some of the committees that I belong to. Yeah, so when I first came back, I was very much a clinician and trying to set up the services at UMMC. And then it became very clear that we have a problem with infection amongst people who inject drugs, because every second patient or more that I saw were amongst people who injected drugs. And yet I didn't see this in Australia because they had instituted the harm reduction program, the needle syringe program, even before the AIDS epidemic. It was actually to prevent hepatitis B transmission. And so my older sister, and Marina Mahade are friends. And my sister said, you should speak to Marina, who was at the time was the president of the AIDS Council. And that's how she said, come and help us. And then I was asked to join the EXCO of the AIDS Council. And when Marina decided to step down, she asked me to take over. And and I've been there since, not as EXCO, but I was president for a while. But now I've continued on as chair of the AIDS Foundation for too many years. It still continues to this day, right? And when people ask me, and haven't you done enough, or aren't you tired of this? But every single time something will happen to make me realize that the job is not done. For example, last year it was the arguments around pre-exposure prophylaxis, which is taking a pill to prevent someone who is at high risk from getting HIV. Now, we've known about this for more than 10 years, that it's hugely effective, that if a person who is at risk takes this pill, that there is a more than 90 chance of them not getting HIV. And so from a medical viewpoint, from a scientific viewpoint, there is absolutely no question that this is something that needs to be provided for people who are at risk. But there are many quarters who say that no, you can't be. It's the usual argument. You can't be encouraging people to have sex. You can't give it to people who are not married. You can't do this. You can't do that. Now, in my mind, and I'm very clear about this, that if we have a tool that's scientifically proven, that's going to prevent someone from getting a disease that's potentially fatal, even though there is good treatment for it now, but it is still not a disease that anyone wants, right? Then we should make that available. It's no arguments. What someone does, who they love, who they have sex with, is not a doctor's business, right? Our business is to prevent them from getting harm. So yeah, I got kind of riled up about that, and particularly when a particular medical educationist says that that's not the right thing to do, because we teach medical students not to judge. Yeah. And the second thing I want to say, how things happen which continues to motivate me, I suppose, is over the last 3 days I've been involved in discussions and workshops around drug policy reform, which is something I wouldn't say I've moved on to, but I've added on to some of my work, and it's a natural progression, because I've been focused on HIV, focused on what we call key populations, particularly people who inject drugs. And through that, and through my work in in prison, particularly Kajang prison, it's very clear that unless we address the root cause, which is our punitive drug policy, we're going to continue to have people not just. Fortunately, with the harm reduction program, we've reduced the risk of HIV transmission to some extent, hepatitis C, but we continue to put people in prison, putting them at risk of TB, etc., etc. And so my thing now is advocating for sensible public health approach to drug policy. And so over the last 3 days, we had this consultation with different stakeholders, Ministry of Health, NGOs, ADK, police came for a while, the Bar Council, etc. And one of our speakers is this, I've actually not met her before, but it was wonderful that she came forward to speak. And this is when I get really emotional. Pardon me, when I'm tired, I get really emotional. And she came forward and shared her story with us. Turns out that she, is a graduate from Dublin in ACCA, and unfortunately went into a very troubled marriage and suffered rather horrific domestic violence. And as a result, became extremely traumatized by it all, went into severe depression, somehow got hooked on drugs, and for quite a significant period of her life was really, really, for want of a better term, down in the dumps from drug use, lost a job, etc., etc. And was only able to kind of come out of this through, I seriously think, grace of Allah, because she actually, the way she described it, she overdosed and her friend ran away, but somehow she lived through that and then decided, enough is enough. And spoke about her time in prison and why we needed to support people like her. And like I said, she's only here to be able to share us a story by the grace of Allah, and also by having a supportive family. And it was such a powerful story, and kind of made me recommit to do this work again. And here I go again. Because of the circumstance that put her into this. She had a really good job, and now although she's found her feet again, but it's going to take her some time to rebuild her life again. And so that whole thing of punishing her twice, essentially, because she went to drugs because of her life circumstance and then ended up in prison, etc., is just so wrong, Yeah. I think it's a bit of this and a bit of that. I think certainly from my childhood, perhaps, like I said, from a family who looked after each other, and including people who were less fortunate. And Australia was probably quite a big part of that. And now that I'm here at Monash and being part of all these programs in terms of putting a lot of emphasis in giving back to the community. After all, that's what is one of Sir John Monash's famous quotes. It's about being and giving back to the community. That somehow is seeped into my DNA, I guess. And the specialty I've chosen to be a part of, you just can't look away. And this global community like the International AIDS Society, also, that I've been part of for many years, seeing how others less able to but give back to each other, it's very inspiring. So yeah, COVID is of course part of, it's a core business for me as an infectious disease physician. And I still recall when the early days of COVID, when the news that there's these strange cases in southern China, my colleagues and I in the infectious diseases unit at UMMC, our sort of antenna sort of perked up, and I was dean at the time, so I was doing far less clinical work. But Sushila and I said, and Sharifa Farida, who was at the time heading the infectious diseases unit, we better get prepared. Learning from the SARS experience. So there's this program called ProMed, which is part of the International Society for Infectious Diseases, that monitors outbreaks all around the world. And we were all, keeping an eye on that. And so I still remember very clearly, it was late December, early January, and then we decided, let's put together a task force at UMMC to monitor this, to be prepared in case anything happens. And although I was dean at the time, was doing far less clinical work, I said to the director of the hospital, this is going to be big. I will leave the running of the faculty to my deputies. I'm happy to take charge of this, and didn't know what I was getting myself into, because after that it was like we met daily for, I don't know, a year and a half. But it was I wouldn't say wonderful, but it was a very important experience, because I brought the whole hospital together, from engineers to people who procure masks and this, that. So we knew exactly how much the hospital had from all these PPEs, essential equipment, number of beds, movements, training, this, that, and the other. It was important that everybody come together. We essentially turned the entire hospital into a COVID hospital, turn, few wards into ICUs, and yeah, it was tough. I was just recounting this with Sashila the other day. I think one of the difficulties was, in the early days, it was the fear of the unknown. And in a sense, I had been through that with Nipah virus, remember the JE virus, that as a leader, I had to put on a brave face and an all-knowing face. Of course, some people saw through that, but it was important to remain optimistic and like on top of things. And because there was a lot of fear, there was a lot of misinformation, and rightly so, amongst our colleagues, doctors and nurses. There was this fear that you were going to bring the virus back to their children, to their relatives, which is all completely understandable. And so we had to provide quarters and all of that for those who didn't want to bring the disease back to their families. And so, yes, I played an important role leading that, but I had an amazing team at UMMC. We all came together, to do what we could, and of course at the national level, and also felt important to provide the voice to counter some of the unnecessary things that were being done, like spraying buildings and walls, and these distractions that were costing money, and yeah. So that was my famous fight with one of the ministers. I did feel that it was important for me to speak up, even if it's ministers doing things that were unscientific and draining important resources away from much needed resources. Yeah, so I just couldn't stay quiet. Yeah. I think not. I think never. I think, I always feel, and I think this is, whenever people ask me to speak to young graduates or whatever, I think it's really, really important to always do the right thing and have that principle. Of course, it has to be backed by facts, and you're not just countering someone, or you're not just speaking out just because. It's important that it's based on facts and evidence, and if you have that, then you shouldn't fear about doing the right thing, because that's I feel that that's my role as a leader, as a specialist, as an expert in the field. Yeah, so I have chosen a particularly difficult field, right? HIV, drugs, men who have sex with men, transgender. Um, um, I think it goes back to basic defense of humanity, basic defense of human rights. And maybe because I'm comfortable, I'm privileged, and you want to sack me, okay, fine. But that's never really crossed my mind. Yeah, it's about doing the right thing, and it's not as if what I'm saying is heretic or totally outrageous, is it? It's just about doing the right thing that's backed by science and evidence, and ensuring that people live a healthy life, and yeah, I don't think, yeah, nothing to be afraid of, really. It's coming from a good place. Why is there to be scared of? Yeah. So there was an interesting time, apart from COVID, when I chose to highlight the misappropriation of resources to doing things that were not kind of helpful, like spraying roads and drains. But it was also during, we did this very, very large research showing how putting people in compulsory detention centers for drug use it doesn't work, right? And we compared it with people who were receiving treatment in the methadone treatment in the community. It was a study that took a long time to plan, rather difficult to do, working with the best, colleagues from Yale, from University of New South Wales, funded by the World Bank, published in the best medical journal, The Lancet, had an editorial by, in the Lancet on the study. I mean, you couldn't get any more kind of scientific validation than that. One of the, best medical journals in the world, and with an editorial, and the UN, it was also complemented by the UN system, and so forth and so forth, picked up by local and international newspapers, only to have and basically what the study showed was people who are released from after mandatory treatment in compulsory detention centers do, surprise, surprise, far worse than those who receive treatment in the community, relapse a lot earlier and a lot more frequently. And so the conclusion was we shouldn't continue this practice of having mandatory compulsory detention centers for drug use, which is something that we've been saying together with the UN system, including UNODC, for many years. So this was picked up by local newspapers, only to have I think it was the Deputy Home Minister at the time who said, well, great, but, if Prof Adeeba, who was the Dean of Medicine at the time, wants to look after all these drug users, then she's welcome too. So, yeah. So, I mean, it didn't keep me down. I mean, I was only to be expected, kind of was my reaction, but it didn't sort of stop me from continuing to do what I do and continuing to feel that we must continue to show local evidence and local impact of all these misguided policies. Really implementing the harm reduction program in Malaysia, and the ability to do that 15 years ago, 10 more than that, 20 years ago, and seeing the results of that, and bringing down the number of people living with HIV as a result of having access to clean needles and syringes, and strengthening the ability of our partner organizations, our community organizations to provide really essential services, and working together with Ministry of Health to do that. So bringing everybody together towards a common goal, and including funders and corporations. Yeah, it's not one single thing. It's all of that. So that's from, I guess, HIV, infectious diseases, and in terms of medical education, I think what I have left behind at UMMC, I think, and very proud of the next generation leaders, whether it's the current dean who's leading the Faculty of Medicine. She was deputy dean during my time, and a deputy dean who's still there, who's continuing our work in trying to strengthen the specialist training program in Malaysia. And of course, the team who are continuing the clinical work and research in infectious diseases and HIV/AIDS at the hospital. So it's a combination of things, I don't feel just one single thing. Yeah. It's got to be my two boys, without a doubt, and that trumps all the other professional things I've just described. I think, I'm very, very proud of them. Not just from their professional success. I mean, they still have some way to go. Lokman, the older one, is training as a lawyer in London in a very prestigious firm, and Karim is counting carbons in a company that does environment and data, and both are doing very well. And so, yes, I'm of course very proud that they've both graduated from very good universities and went on to do postgraduate. Now have on their way, hopefully, inshallah, to be successful in their own right. But on top of that, I think are very well balanced individuals, and yeah, that any parent would be proud of.
How old are they?
27 and 25. I think leading the Malaysian AIDS Council, without a doubt. And I think people who've experienced leading NGOs, it's also the most fulfilling. But because I'm being a bit facetious here, but leading a bunch of people who are very, very passionate has its own drawbacks, because there's a cat fighting, there's all of that, and then of course the lack of resource, and doing good work can't just rely on passion alone, right? So having to find the funds and support them, train them, do all that is tough. And on top of that, I had my day job, right, at UM. And so, yeah, looking back, that was probably the toughest. And possibly I neglected, maybe not my immediate family, although my kids will probably say, yeah, Mom, you went to one less, kind of drama presentation or sports day than you were supposed to. But, my husband and I try and be at every single parent-teacher sort of discussions, sports days or whatever. If we both can't be there, then one of us will be there. Or we would never travel together for work. One of us will always be home, even though I had, I could only do what I have done because I had superb support from family as well as helpers. Now, going back to what did I sacrifice? And I think in terms of, yeah, maybe not the immediate, well, of course, my children, could have probably done with having me a lot more than I was, but perhaps the next level family, parents, brothers and sisters, yeah, yeah, will probably, I had less time for them. And still do have less time for them. They'd say like, whenever we call you in some other parts of the world, yeah, it's fine. I don't think it's fine. It's yeah. I mean, yeah. I wouldn't say. I think yeah. If there was 8 more hours in a day, that would be where I would put those 8 hours towards. And friends, Bearing in mind that it's been a few decades since I went to university and now, I think the first thing to say is things have changed a lot, right? Especially in medicine, where in those days, we relied a lot on learning about the content of a particular discipline. I think now all graduates, not just in STEM, or all students have to really be able to think critically, be adaptable, and be curious. Because things are changing so very, very fast. The advice I give today is going to change probably in the next few years, right? So I think read widely, not just in your particular discipline, because everyone around you, not just your employers, are looking for people who uh, are connected to what's going on in the world, and yeah, to be able to adapt and to solve problems and challenges and barriers are probably, probably one of the most important attributes, because content, literally, whatever you want to know, is at our fingertips and more, right? So being able to look for that content and analyze, critically analyze, does it really appear is it really what it appears to be? Because the ability to judge whether this is right or this is wrong, whether this is true or whether this is false, is equally important, I think. Yeah.
True.
As you may have gathered, I'm not one who planned my career. It kind of happened organically. So when opportunities come knocking, I think really take a look, and don't be afraid to try. Yeah. But also there needs to be some kind of planning. I don't want people to not everyone may be as lucky, and to just kind of go head on and just wait for opportunities. I think have a reasonable idea of what you want to do, where you want to be, but be also open-minded as to the different opportunities that come knocking. But again, particularly since the world has changed, right? Um, y- you may not even know of that. There may not even be a name for a job that might be right for you these days, right? But maybe may suit you. Yeah. So, Uma's parents. Uma grew up in Australia, and his parents were kind of the de facto Malaysian family in at Monash, particularly. But in Australia, his father was a professor of anthropology and sociology. So those early Malaysian students who went to Monash, whether for the Colombo Plan or later through government scholarships, will always look for Katnab and Professor Swift. And so, you know, when I went there, I guess, they were quite active in the Malaysian society. And that was how I met Uma through, but also because we were at uni together. And yeah, we can say that we met at Monash. And I managed to convince him to come back to Malaysia. So there's a brain gain for you there. And yeah, and he trained as an accountant. Yeah, but he's now in the corporate world. I don't know about that, but if I had more time, that's also what I would do more. Someone just gave me well, Terence Gomez gave me a book on that he's just published on governance and corruption in Malaysia, which I intend to read very soon. But also, the CEO of Kenanga gave me the book on Tengku Nur Zakia, who is, of course, a very inspiring, pioneering woman, the first female stockbroker, and highly successful. Now, if I grow to 90 over and be like, I call her Cik Noor because we're distantly related, I'll be very proud. So I'm embarrassed to say that I haven't read her book, but tomorrow I'm going on a short holiday, and that's a book I'm taking as well. Several things. I'm addicted to crosswords not on those mobile games from the New York Times. So I start my day with a combination. My staff shouldn't hear this, of Wordle. Then we compare notes with some of my friends in the US. Wordle, something called composition, is it the one that the groups? I see that you're a fan as well. The 7 words and the mini crosswords. So the spelling bee comes later in the day. So I do that at the end of the day. But the other 3 I do very quickly in the morning, and then I feel like I'm ready to go to work. I think it's also good to keep my aging brain alive. So that's one thing. COVID drew me to gardening, strangely enough. I think COVID and aging drew me to gardening. I used to think that gardening was for old people, and then realized that, actually it's not. It's such a fantastic thing. I don't have a very big garden, but so what happened during COVID? I think some people gravitated to cooking. Not me. Like I'm done with cooking. My children would say, "Mum, did you ever cook?" And I'm like, "But they're better cooks than me." That's the other thing I'm proud of. They're better cooks than me. um, um, yeah, but I I think through the intense period of COVID, remember I told you I led the UMMC task force, got called on to state and national level advisory. On top of that, I was also president of the International AIDS Society at that same time, and I actually looking back at how I lived through that period. But anyway, I sook sought solace, I suppose, in gardening. Lo and behold, some of my close doctor friends at UMMC were also doing that. And then we found out about this. As soon as we all could go to Sungai Buloh, we went to Sungai Buloh together and bought plants. And I've continued with it now, as you can see, my big, beautiful Monstera. And the third thing, which I need to get back to, is exercise. Like I do a combination of yoga, Pilates, and high intensity, and I must get back to swimming for my bad knees. I think going back to my current day job, which is as president and pro vice chancellor of Monash, I hope that what I'm doing here will continue to strengthen not just higher education, but education in Malaysia. Of course, but not necessarily with an emphasis on medical education. I think more broadly, education, research, the importance of those two going hand in hand. And then obviously, the HIV/AIDS work that I do, and hopefully before I die, we see sensible drug policy and drug laws as well.
Exactly.
Because that will impact a lot of lives, not just here in Malaysia, but globally as well. They were looking for, and there was an international search and interviews, and the standard. Tim Winton, an Australian author, I just finished reading his book. Actually, is one of my favorites, and Ian McEwan, British. Yeah, their style of writing somehow, that languid, lingering prose. I kind of like that. My husband and I have completely different tastes in movies. When the children were growing up, of course, the boys, like all the Marvels and the Bang Bang and I used to go to movies with them, and I would bring airline socks and blankets and be prepared to go to sleep. And they were like, "Mom, with all this noise, how can you still go to sleep?" And I was like, "Yeah, I don't really enjoy the movies." So we used to rate movies according to how long did Mum stay awake. Is it through the first credits or the last credits? We knew Transformer was a good movie because I stayed awake throughout the whole movie. But many more was like, what was that all about? I am, but not the sort of the ones, and they don't enjoy my kind of movies, so they always make fun of, the dramas and all of that. Although I did make my son sit through, I think it was Peaky Blinders together with me, and he enjoyed it, when they're back in KL. Yeah. Without a doubt must be Shawshank Redemption. A lot of people say that, huh? A lot of people say that. No? I've seen it. Yeah. I think I was, I don't know, inspiring, very close to what I do. In fact, I watched it long before I got into this prison work. And recently on my flight back from Cape Town, I watched a movie, what's it called again? Rob Pence. It's about this Yale graduate who, a true story, a book was written about him by his college mate, a black Yale student whose father was in prison for murder. And he was a brilliant student who, in trying to defend his father, resorted to drug trafficking, and then kind of his otherwise what would have been a really promising life spiraled. Yeah, I don't know, I get drawn to these sort of movies. It's very close to kind of work I do, but it was it was that I sort of I was on a very long trip back from Cape Town, so watched a few movies. There was that, and plus I've been on lots of flights. The other one, that's when I catch up with movies. The other one that I enjoyed, I'm hopeless at remembering the titles, but this was a Korean movie about this influencer who was kidnapped, and she was in the boot of a car. I don't know if any of you have watched this. Shouldn't give the plot away, but it was amazing that she was, being driven, and she was still doing this influencing thing, and in a sense of capturing that the moment that she was, in this boot of a car. And it kind of just brought to life, the in a way, the absurdity of the current sort of this whole influencer business. I won't give the plot away because it then tells you, what who done it, kind of thing. But it did very, very skillfully bring out these issues around the superficiality of this whole influencer and um, what's the word for it? Craze and yeah, and its impact. Um, yeah, the commercialization of it is just, I mean, I'm not. I mean, horses for courses. If people can make tons of money from it, good for them. It's not for me, but yeah, I mean there's got to be a limit to it, I suppose. Yeah, I think it's we recently hosted a workshop on education, and of course AI was a big part of it, and we invited Vishy, who's leading AI PwC, and I liked what he said. I think it completely resonates with me that we shouldn't see it as is it good or bad, because it's really going to be part. It's already part of us, just like the internet is. Like we better get used to it, know how to use it well, know how to harness what's good about it, but also know what's not good about it, and it needs to be regulated, and we need to have a curiosity about it and be able to discern the right from the wrong, and but also, like I said, harness its power correctly.